implants. What's the truth about all-on-4 dental implants, and what aren't doctors telling you? To get at the heart of this, we have to understand what would be considered success, because depending on your definition of success will really dictate if you're going to be happy with all-on-4. Sometimes optimism can mislead people into thinking that all-on-4 is perfect for everyone and should be done by every doctor all the time. So let's talk about what's promised in marketing around all-on-4. These are the things I see and hear, and it's disturbing, and I think that needs to be cleared up. Number one, all-on-4 is the same as teeth. This statement is so untrue. They'll function like teeth, but you're talking about a bridge that spans from one side all the way to the other. That means there's a junction between your bridge and your gums. You will always have this tendency to get food or particles pushed up into that area. That's not something you struggle with when you have natural teeth. Yes, you might get food in between your teeth, but it's a different experience when you get food up into and under the gums. And I say this because natural teeth would go perfectly into gums, right? This is a process where we've taken out your teeth, we've even taken some of your gums away, and now we're going to create something that mimics your gums and teeth. And so it's not the same. Although it'll give the appearance and it'll give you back a lot of confidence, it's not the same as your natural teeth. And getting clear on that is so important. Something that's often misunderstood is that all-on-4 can replace all of your teeth. And this isn't the case. All-on-4 can replace most of your teeth, but the last two teeth in your mouth aren't replaced with all-on-4. And that's because of the limitations of where your bone's at and where your sinuses are. And so what I tell patients is that you're going to get from first molar to first molar and not to expect more teeth than that. What this means is if you currently have 32 teeth in your mouth, meaning that you have all of your teeth, including your wisdom teeth, you're going to receive at least 2 teeth less on each side. You have to be prepared to know that you're going to have a little bit of a gap back there compared to what your teeth were originally. Something else that I think that can be misleading is that all-on-4 dental implants are going to be easier to take care of than your natural teeth. When you have 28 teeth in your mouth, each tooth needs to be cleaned. The stakes are higher with all-on-4 dental implants because you're going to have 4 to 6 implants on the top and 4 to 6 implants on the bottom. Something else I think that needs to be explained to patients is that all-on-4 dental implants does not work every time for every patient, for every doctor. As doctors, we can be really optimistic, and we don't want to tell patients that things may not work out the way they want. But we have to be super clear about what are the possibilities, what are the chances, what are the risks that come with doing the surgery. There is a risk that you could put 4 implants on the top and 4 implants on the bottom, and you may have 1 or 2 implants not take. That's a risk that you have to be okay with. And if that happens, the timeline is going to adjust, and it's going to be longer, and you might have to go through more surgery. The other claim I hear all the time is it's worth the money. Now, this is different for every person. For some people, they value their teeth, their smile, their ability to chew, confidence. They value it so much. But some people don't value those things the same way. Sometimes doctors give the impression that every single patient that they've ever seen has told them that it was worth it going through the process. The truth is that some patients' experience is different. They experience more pain. Sometimes the timeline is longer than what is expected. One of the things I hear all the time on YouTube videos is the impression that they're going to last forever, that they're so hard and they're so strong. The truth is this: the bridge is strong enough to last a lifetime, but that's all conditional on the implant staying healthy. And that's conditional on the patient being healthy, as well as the patient making sure they do a great job at daily maintenance and then coming back often enough, which could be every 4 to 6 months in some offices. And in some offices, they'll do it once a year. But coming back often enough that you can be corrected if something's off course. And let's talk about the definition of lasting forever. Does that mean that you're never going to have to come in for maintenance, never going to have to come in for things that just arise? It's kind of like buying a car and expecting that car is going to run for the rest of your life without having to do any maintenance on it. There's going to be things that I'm not prepared for, and it may not happen for a few years, but eventually I'm going to have to put a little bit more maintenance into this. One of the last things I hear often or get the impression from these videos is that the doctor is the biggest factor in success. I do think doctors matter. I think that how you do the procedure and the timeline and how you take care of that whole process is so important. But the reality is, you could have the greatest doctor in the world and then have a patient that just doesn't care, that doesn't listen to what you're trying to tell them. And if they're negligent, no matter what the doctor does, you're going to have struggles, you're going to have complications. Things aren't going to go the way they expect. So you have to ask yourself, are you going to be the right patient for this doctor? Are you going to make the process easy? Or are you going to do things that you know are contraindicated, like smoking, or not cleaning under the device, or not coming back for maintenance? Because I can tell you that the best doctor is not going to have long-term, lifetime success if he doesn't have a compliant patient that's really invested in coming back and doing the things that are simple but make a huge difference long-term. I hope this video has been educational for you. My advice is to really listen to the doctor, ask lots of questions, talk to the team and staff, really get clear on what is expected of you. Watch YouTube videos like this by doctors that are not trying to get you to buy a bridge from them or buy All-on-4 dental implants. This video is being done because I just see a need inside of YouTube. I see a need inside of dentistry for just the truth, which is All-on-4 is a great procedure, but it's not for every person. It's definitely not for every doctor. And so do your homework so that you can end up having a successful outcome.